And Professor Jürgen Schwartz for accepting this invitation and granting us the honor and giving us the state-of-the-art situation on two very important aspects that we are faced with every day in our clinical practice. To provide anything which you don't probably know already, it's just a local update on the current situation of respiratory allergies in Pakistan. As you know, Pakistan is, I think in your clinical practices, you see allergy patients every single day. There have been reports in newspapers which say that allergy is the commonest health problem in Pakistan. And I think all of you will bear me out that it is indeed very, very common on this. I don't have any significant conflict of interest to declare except that I am the Press and Information Secretary and one of the organizers of this conference. A very common concept that we've been seeing, and many of our doctors have actually been reporting this over the last 25, 30 years that I've been teaching. And they usually observed that when a patient, and I'll first apologize to Professor Durham and Professor Schwartz that I'll also be using Urdu during my presentation, कि डॉक्टर साहब हमारे पास मरीज जुकाम से आता है और 2-3 साल बाद वही मरीज दमे के साथ आना शुरू हो जाता है. The doctor, we see a patient with rhinitis, and a couple of years later the same patient comes back to us with breathing problems and asthma. And when obviously more research was done on this, then the concept of one airway, one disease, and allergic rhinitis and its impact on asthma, the ADIA program, in which I have a great honor that Professor Stephen Durham is on the same committee, and I'm one of the small little pawns in that. What we've done over the years is look at statistics and to see that actually promote the fact that if you prevent rhinitis early enough, you can actually make a difference in asthma management. And this is where the difference between a pulmonologist, an ENT physician, and an allergist comes in. The pulmonologist is only looking at the lower airways, the ENT is the upper airways, and the allergist is the connection in between. So it's one airway, you're breathing something in from the nose, and contrary to our previous concept, dust and pollen particles do not go down into the lungs as much as we thought they do. It's the response in the lower airways to prevent those allergenic particles from coming down which causes bronchoconstriction and wheezing. When we did the ISAC study, the International Study on Allergy and Asthma in Children, we found things which we were totally shocked. We, the Allergy and Asthma Institute, did this study back, I think now more than 20 years ago. And we found that 7% of the children in the study were diagnosed asthmatics. But 13% of the children in the study, now this is going to schools, giving them questionnaires and asking them common questions. Do you cough when you laugh? Do you have coughing at night? Does it wake you up? Do you have wheezing when you breathe? And 13% children answered yes, who had never been diagnosed. So 13 undiagnosed, 7 diagnosed. 20% of our school children, that's 1 in 5, were asthmatics, and we didn't know about it. And what are we doing? They're getting antibiotics, they're getting oral steroids, they're getting cough syrups, they're getting cough suppressants. And for God's sakes, a suppressant in a patient who's coughing to get oxygen is the worst thing you can do. We looked at hay fever symptoms. Karachi was 30%, and this was done by the Aga Khan Hospital. And the Allergy and Asthma Institute, we found that more than 50% of children in Islamabad suffered from allergy. Now these are data which have not been publicized so much. Now I'll skip a lot because of interest of time. Easy Pakistan has published some data, and that is really alarming because they say that the annual increase is 5%. The only thing I think which increases faster than asthma is the price of petrol these days. That increases at 5% every day, I think, the way it's going. We recently did a study on looking at, this was a questionnaire-based study backed with spirometry throughout 4 countries of the region, Bangladesh, India, Pakistan and Malaysia. And you can see that the highest suspected prevalence of COPD was Pakistan, as was asthma as well. I don't want to spend too much time, but this is the sort of figures that we're dealing with. And I am not talking about pharmaceutical pumped studies like we have given to clinicians. Dr. Sahab, please your form bhar dein, and they ask their secretary that can you please just fill this out in your office because we'll get a trip to Europe in return or something. No. This is studies being done, these are studies being done in the community. Ye halat hai. When we did allergy test studies, these are skin prick test results. I have not put the number of patients, but that varies between 4,000 to 10,000. As Professor Durham pointed out very rightly, house dust mite is more than or around 60% of our people. If you vacuum cleaned this carpet and you looked at it under a microscope, you would never sit in a carpeted room again. If you vacuum cleaned the mattress, you'll find how many people sleep in bed at night other than you and your spouse. So it's very important to know what the problems are. And then we have so many dusts from, for example, wheat threshing. Wheat threshing season is going to start in 2 weeks in Pakistan. KP will be the first province this year because the temperature in KP is going up. Sindh will follow and then Punjab. And we've actually taken satellite images and seen that from those big harvesters, these two, my great professor friends from KP are sitting. वो जो बड़ा हार्वेस्टर जो काबुल से अफगानिस्तान से आते हैं, उनकी डस्ट 16 मील तक जाती है. So the dust goes 16 miles, and we've checked that from satellite images. But those are the big harvesters, the big ones. So a patient won't even know why he's having an asthmatic attack. Rice dust, cockroaches, big allergen, molds, fungus जिसको हम कुल्ली कहते हैं, दीवारों पे सेम जो लग जाती है. You've got the black fungus, Aspergillus niger, and you've got Alternaria tenuis, the green fungus. Highly common, but very strongly allergenic. They can cause very severe asthmatic attacks. पुरानी अलमारी खोली, सांस खराब हो गया. पुराने स्टोर में गए, सांस खराब हो गया. वॉशरूम में गए, जहाँ पे ऊपर फंगस लगी है, वहाँ पे सांस अटैक होना शुरू हो गया. These are things. नमी के मौसम में कराची is a disaster in humid weather for asthmatic patients, especially people living near the sea. So ये सारी चीजें. Then you've got pollens, paper mulberry pollen, and all of you know paper mulberry has been publicized so much. The highest pollen counts ever recorded in the world are paper mulberry pollen. 49,500 grains per cubic meter. In Europe, grass pollen 5,000 से ऊपर होता है, it's considered very high. कहाँ 5,000, कहाँ 50,000. That's why paper mulberry is a lethal pollen, it kills people. The common respiratory allergens, I'll go through this very quickly. House dust mite, normal fungus which I have just shown you. In buildings, especially these are pictures from Karachi, the old buildings in old Southern, well this wasn't Southern, this was near Napier Road area, so you can see the fungus there. Cockroaches, the German and the American cockroach. Paper mulberry, as I've just shown you, you can see clouds of pollen coming out of paper mulberry trees. Anyone who's unfortunate enough to be standing there and be sensitized, it's disaster for him. Cannabis, जो लोग भंग पीते हैं उनके लिए तो ठीक है, but inhaling the bhang pollen is a disaster. normal grass, what we call American grass, Cynodon dactylon, इसके ऊपर जब नमी के मौसम में फंगस आ जाता है, this picture on the extreme right, ये इतना पोटेंट एलर्जन होता है कि खास तौर पे जुलाई और अगस्त इससे सांस लेना मुश्किल हो जाता है. We are a cotton producing country, sorry, wheat.
ये हमारे इलाके में बहुत.
अब तो थ्रेशर शुरू हो गया है ना. So this is the season that you should be aware of these things. Rice husking, जहाँ राइस की शेडिंग हो रही होती है वहाँ पे भी ये सारी चीजें हैं. दालों की मिलिंग, ये सारी चीजें आप देखें, उनमें फिर स्टोरेज माइट्स पड़ जाते हैं. Then of course, like this picture from Karachi, this is taken behind Karachi University, Kikri, Prosopis uriflora, and you can see the catkins are similar to that of paper mulberry, ragweeds and other pollens. The other thing, now I'm going to change slightly. Our temperature, Pakistan ka temperature over the last 100 years started going up. Pakistan used to be in the 1900s relatively cold country. ग्लोबल वार्मिंग से क्या हो रहा है कि आहिस्ता 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 बात देख रहे हैं, हमारा एवरेज टेम्परेचर जो है वो 50-40 प्लस जा रहा है. और इससे क्या फर्क पड़ता है? इससे फर्क पड़ता है प्लांट्स पे. ये पोलन्स की पीक इस्लामाबाद की आप देखें 2020 में पोलन की पीक जो थी वो 25,000 30,000 25,000 की रेंज में जा रही थी. अब ये कहाँ से चली गई है, कहाँ तक? अभी 2024 में सिर्फ बारिश हुई है तो बचत हुई है, अदरवाइज ये पीक्स तो हमारी 50,000 एक्सपेक्टेड थी. आप खुद सोचें, जब 5,000 के ऊपर सिम्टम स्टार्ट हो रहे हैं, 50,000 पोलन पे पक डाउन, और ये सारा ग्लोबल वार्मिंग का इफेक्ट है. And lastly, for those of us from Karachi, this is a picture of DHA, Defense Housing Authority. 30 years ago, ये जो लाइन है सनसेट बोलेवार्ड, इसके बाद कराची नहीं होता था. हमने लैंड रिक्लेम की है समंदर से. When you reclaim land from the sea, it has a different texture of the soil, and that different texture promotes those things which are unnatural here. And that is why you will find more illnesses, respiratory illnesses, in the reclaimed area as compared to the people living in Nazmabad or Sohrabpur, which is sandy soil. So Karachi जैसे शहर को आपको allergy पढ़ना है, you have to study the environment, the soil and the plants there, and that's what makes the difference. The last thing I want to point out again, this was a sort of an, I would say, supporting Professor Durham's presentation. Pakistan mein, we have unfortunately a lot of quackery in the field of allergy vaccination. There are institutes which make one mixed dust and mixed pollen vaccine and give it to hundreds and thousands of patients all over. Allergy vaccination has to be specific according to the patient's illness, according to where he lives, according to which season he is having problems. So when we know that paper mulberry जो है वो मार्च अप्रैल में करेगा, paper mulberry, अब आप पेशावर की बात करें, paper mulberry is the highest concentration in Hayatabad phase 3 and Kalkano Bazaar. Warsak Road is bhang pollen, cannabis. There is no paper mulberry in that area. Come to Sadar, come to Old Peshawar city, it is all dust mite, it's no pollen. So every single area has a different seasonality of the illness. उसके हिसाब से आप treat करेंगे. So if you are going to give immunotherapy to someone just on the basis of a skin test which does not correspond with his symptoms, it will not work. And when you have non-specific allergens, you will get non-specific results. So we can have tons of talks on immunotherapy and allergy vaccination, but it has to be specific. It has to be for each and every patient according to his skin prick test. Like Professor Durham pointed out, the tablets for house dust mite. If someone is sensitized to maybe hundreds of allergens, and the test that you're doing is not specific for dust mite, you may not pick it up, so it may be a problem. So just to close there, I want to thank you all very much, and sorry that the session is